Okay, my name is Hannah and I'm going to be your nurse today. What is your name?
It's Grace McIntyre.
Okay, do you want me to call you Miss McIntyre or Grace?
Grace.
Okay, what is your birthday?
It's February 15th, 1995.
Okay, and do you know what year it is?
It is year 2021.
Okay, and then do you know where we are?
We are currently in Little Rock, Arkansas.
Okay, and then who is the president?
It's President Biden.
Okay, so today we are going to perform a head-to-toe assessment, and we'll be going through every system, and it will involve me touching and looking and listening. Are you okay with me doing that?
Yes.
Okay, so what is your weight?
I weigh 137 pounds.
Okay, and what is your height?
5'4".
Okay, do you have any drug allergies?
I am allergic to penicillin.
Okay, let's see. Okay, so then we'll start with getting her vitals, and I will check for her heart rate and respirations, and then also, if we had the equipment, we would do her blood pressure and her pulse ox, and then also we will check blood pressure, heart rate, respiration, pulse ox, and her pain level. So on a scale of 0 to 10, what is your pain?
0.
Okay, so we are going to start with, as soon as she would walk into the room, we would notice her gait and document if she has any issues with sitting down or with walking, or if she has problems with getting up from the chair. But since she's already sitting, we're not going to be able to do that. So from as soon as they walk in, also we'll be assessing their skin as we're going through the vital signs and stuff. I do not see any bruising on her extremities, any bruising around her neck, or let me see your legs, or on your legs. Okay, and then I'm just gonna feel if there is any swelling. Sorry if that tickles. And is there any tenderness when I am feeling?
No.
Okay, so we are gonna start. Well, also her skin was warm to the touch. Her skin is tan. It's appropriate with her ethnicity. And so now we are going to start with her head. I'm going to palpate. Is there any tenderness when I do this? Okay.
None.
And then I'm going to check and see if she has any lesions or bumps or any abrasions. And she does not. Her hair is clean. It is short and it's brown. And now we are going to go onto her face. So I would check to see that her nose is symmetrical, or it's midline of the face. Her eyes are symmetrical on each side. She does have eyebrows and eyelashes. Do you have any tenderness when I'm just touching anywhere on your face?
No.
Okay. And now I'm going to check your nose, see if it has any swelling inside or if it's inflamed. Have you had any problems breathing outside of your nose?
No.
Okay, so her nasal passageway is pink and moist. Her nasal pathway is patent. She does not have any issues with breathing through her nose. And now I'm going to check your eyes. So her conjunctiva is pink and moist. Her sclera is white. Do you have any tenderness when I'm going around your eyes?
No.
Okay. And I do not see any edema. And now I'm going to check your mouth. You can just open your mouth. So I don't want to pull your lip down. So let's see, her uvula is intact. And her gums are pink and moist. Her tongue is also pink and moist. There's no broken teeth, or none of her teeth are loose. Her lips are also pink and moist. And so, let's see. I'm going to check your temporal pulses. And so we'll do that for 15 seconds. Okay. All right, now I'm going to check your sinuses. Do you have any tenderness when I am applying to the frontal sinus?
No.
Okay, what about the maxillary?
No.
Okay. No swelling of the sinuses. And so now I am going to check your ears. I'm going to see if there is any lesions or abrasions. And I will use a pen light to look inside to see if there's any excessive earwax. And then let me come over here. Okay, no lesions or abrasions that are noted on her ears. Let's see. So now we're going to check your cranial nerves. So it's cranial nerve number 2. It's the optic. So we do that by seeing if you're able to read my badge.
Okay.
Can you read it?
Yes, it says Hannah Neiman.
Okay, and so then with cranial nerve 3, 4, and 6, we are going to check for Perla and her EOM. So by doing that, I want you to keep your head straight, and I just want you to follow my pen light with your eyes, okay? Okay, and now I'm going to check to see if your pupils are reactive to light. So I'm going to cover up one eye. Okay. Okay. So her ocular motor how do you say it?
I'm not gonna say it.
Abductions, and I can't pronounce the other one, are intact. There's no jerking or painful eye movement. Her pupils are equally round, reactive, or reactive to light with accommodation. She's able to read my name badge. Also, so then we'll check cranial number 7, which is facial intact. So with that, I'll have you blow your cheeks out. Okay. And so that is intact. And now we'll check the cranial number 5. And that will be if you can feel light sensation. So I'll just have you close your eyes.
Okay.
Okay, and so I'm just going to see, can you feel this?
Yes.
Okay, can you feel this?
Yes.
Okay, and what about this?
Yes.
Okay, and so the cranial nerve 5 is intact. Let's see, and do you also wear contacts or have glasses?
Mm-mm.
No?
No.
Okay. And no prosthesis, eye or
No.
anything? Okay. So there is no going blank. Okay. There's no what's it called? Prosthesis, and the patient doesn't wear contacts or glasses. And so also while we're on the head, I'm going to check all of her lymph nodes. So right above on both ears, right in front of them, that is the preocular lymph node. Okay. And then we have the tonsillar, which is right below. And then we also have the submandibular, which is kind of right at the back end of her jawline. And then we have the submental, which is right under her chin. Okay, and then right on the back side of her ear, we also have the postocular. Okay, and then on the neck, we have the anterior cervical, and that's just kind of down on each side. And then kind of towards the back, we have the posterior cervical. And then kind of more towards on the back, she'll have lymph nodes right on the side, and those are the occipital lymph nodes. And then right here is her subclavicular lymph nodes. Is that how you say it?
Mm-hmm.
Okay, yeah.
I think so.
Okay. And so those are all her lymph nodes. Let's see. So we went through your head, your face, eyes, ears, and nose. Also, we would want to check cranial nerve number 1, and that is to do with smell. So for this purpose, I'll use a marker. So I'll have her close her eyes, and then I'll just put this right in front of her. And can you smell that?
Yes.
Okay.
And I would tell her that it's a marker.
Okay, so the cranial nerve, 1 is intact. She's able to identify smell. And then also, let's see, I did your temporal. I guess while I'm still here on the neck, I'm going to check her carotid. Okay, now I'll check this side. Okay, her carotid pulse is bilaterally equal. Also on her neck, I'm going to make sure that there's no swelling or tenderness on either side of her neck, and that her what's it called?
I can't think of it. I just call it the Adam's apple.
Okay, her Adam's apple is midline with her neck. Okay, so I'm going to pause for a second